So if everybody watching this show today commits to washing their hands when they get out of the toilet, before they handle food or handle water, right? Especially, and not just at home, for those who work in the food and beverage industry, those who run restaurants, hotels. If you commit to hand washing by yourself and all your staff, and then at home we commit to also washing our hands, I think that is a good start. It's cheap and it's something that is easy for everyone to adopt. Secondly, if we all agree today that we are not going to eat half-cooked food, our food are going to be properly cooked, and we're going to use clean water. If we agree that in our own immediate environment, right, we will keep our environment clean, right, I think that those are the ways we can minimize the spread of cholera in an outbreak like this. But however, as you rightly said, there are some people who will not do the right thing unless they are compelled to do. So that's where policies and laws come in. And that's why there's also a need for us to go back to those days where we have sanitation officers who ensure that people are keeping their environment clean, and maybe there are sanctions or consequences where people litter the environment, or maybe are not even preparing food. So we had also officers who go to restaurants, who go to food chains, who go around, and if the way you prepare your meal or your food, it's not the best practice, it's adopting the best practice in terms of sanitation and hygiene, those food chains and industries are also sanctioned. So I think there is need to introduce all that, but then let's start with the basic ones: hand washing and good hygiene at home.
And like you mentioned that cholera is a sickness of poverty. What do you make of food vendors who use raw materials, who use materials that are not up to quality, just to, get as much profit as they can? If I decide to wash my hand before leaving the house, and I decide to patronize them while being outside, at the end of the day, it's really not as effective.
Yes, I think that I need to say this clearly today, and this is something that we all need to change as Nigerians, our culture, our way of doing things, right? There is no right reason for doing a wrong action. I know some people who are watching, who are into business, will say, hey, how do you expect me to make profit when to get water is now very expensive? To do this is expensive. Maybe fuel or gas, kerosene or gas to cook is expensive. How do you want me to cook the food properly, right? But that is not an excuse to do the wrong thing, because you think about it. We talk about, I would say, what do you call it, in quotes, ritual money, bad money. If you do something intentional, right, to hurt a group, right, that can also be seen as an evil money, because you're trying to make profit, and then in the process getting people ill, killing people, because cholera is a very, very dangerous disease. It's a disease that if you get infected, you would have frequent acute diarrhea, that is stooling, frequent stooling, and if nothing is done, if you can't prepare a quick ORS to give to that person and then rush the person to the hospital to get rehydrated and treated with the right antibiotics, that person might get into severe dehydration, heart failure, renal failure, and death, right? So this is a call to people, especially food vendors, those who prepare the food the public eat. Please, there is no right reason to do the wrong thing. Make sure you prepare your food in a hygienic way, use good food. It's better to even add a little cost to your meal and prepare in the right way than trying to cut costs and make that large savings and at the detriment of people's health. Because cholera is real, it's killing people. As you mentioned earlier on, there's over 140 cases and 30 deaths. And even in a country where there is also a gap in our surveillance, it might even be much more in local communities that are not reporting such deaths.